And welcome back. And we're getting ready to move into a first conversation for today with representatives of the Ministry of Health. Joining me this morning, we have Nurse Eufemia Waight, who is the manager of the expanded program on immunization for the Ministry of Health. And we have rural health nurse with the Ministry of Health, Kevin Dawson. Good morning and welcome.
Good morning and thank you.
So we're currently celebrating Vaccination Week in the Americas. And I want to start off by just talking a bit about statistically where we are when it comes to the vaccination coverage for the country.
Okay, and thank you for this invitation, first of all. And yes, in terms of the coverage for the country, we are, for this year, we are at 93%. Actually, we went down one because last year we were at 94. But generally, very well for the past 10 years, we have enjoyed, like say, 95%, 96% coverage. It is a challenge, but it's something that we need to face every day.
Now, what are the specific challenges when it comes to executing the immunization schedules for Belizeans?
It's just getting persons to, parents to comply, bringing their children for vaccination, and it's actually getting to those who are hard to reach, sometimes in not only geographic, but also to get them to accept the vaccine and to understand the importance of vaccine.
Yeah. Now, one of the things we know is that because of how the population is widely spread in Belize, that it takes the work of rural healthcare workers to really be able to fulfill the mandate of getting people to get immunized. And I want to ask you, Kevin, about your own personal experience and work. You work in the Ladyville area. Yes. Tell me about what it's like for you to be able to ensure that you engage the entire community in getting their children immunized.
Well, we would sometimes go to the schools. We would do health education in those areas. We also regularly go out to the community to visit people. Sometimes it's not that people don't want to get vaccinated, it's just that sometimes you don't get the time to bring the kids to the clinic. So we regularly go to the community and visit them in their homes and things like that, make sure they are getting it for the ones who are slipping through the cracks, so to speak.
And what allows for people to slip through the cracks?
Sometimes, I think Kevin would more answer that.
Yeah.
But sometimes what reaches to us is long waiting periods, and you know that is something that sometimes cannot be helped because then it is a public facility and where we have a lot of people coming in. And so we are trying to move away from having just one-day clinics, which is something that we have seen that has a long waiting period. So we're trying to move from a one-day clinic to having the sessions on all through the week, so that we help that.
So you wouldn't have to go in on a specific day for vaccinations.
Yes,
you can go at any point.
At any point, and so within the working hours, and then so you don't have to worry about going to the clinic and spending a long day there, because that is one of the things that most persons complain, that they have to wait a long period of time. But I wanted to mention though that in terms of reaching the people out there who do not come to the facility, we have, and being that we have many rural communities, the nurses go on a mobile clinic session on once a week or twice a week to reach out to those people in the mobile clinics that we call.
And anything different in terms of your perspective as to why people slip through the cracks?
Well, it's just like
it's a long waiting line still?
Yeah.
Okay.
And then, like I said, during the weeks, people are working. Sometimes even on the weekend, people are working. It makes it difficult sometimes. Sometimes it's only the babysitter who has the child at home, and they don't necessarily always come to the clinic. All right. So in some cases, the parents want to be there themselves to be the one with the child when the child is getting vaccinated. So it makes it hard for them who are working.
Now let's talk about what the schedule includes in Belize. We have recently added, I know of two new vaccines. That would be the flu shot and the HPV vaccine. Let's talk about what has been included.
Okay, we have routinely, we provide vaccination against 10 diseases plus, I could say 11 plus that would be adding the flu, but the flu is not for it's just groups, at risk groups. And then we have included the HPV vaccine most recently in the routine immunization that started this year. And coming on May, you know, we are going to have the second round, which is to provide the second dose of vaccines. So those are generally what is provided on a routine basis against 10 diseases, 11 with the flu for the under 5 population, and then of course the HPV for now the adolescent population. Then we have the tetanus vaccine that we provide to the pregnant women to protect the baby against tetanus once, you know, the risk is there when the baby is born.
Yeah. Now, how does our schedule compare to other countries in terms of our coverage?
With other countries, when it comes to the ages and whatnot, it's about the same. We have the same as in the Caribbean, and we in Belize we have good coverage compared to other countries who are presenting 70% and 60%, and we are having over 90%. Yeah.
And the schedule, the vaccines that are actually implemented in Belize?
Okay, we still have more vaccines to be to introduce, and so while other countries are providing like 20 vaccines already, we, as I said, we have 12 with the HPV, and like in other countries, they already introduced the rotavirus vaccine and the pneumococcal vaccine, which are two good vaccines, one in the prevention of diarrhea due to rotavirus, and then the pneumococcal vaccine, which helps against pneumonias in children, and at the same time would protect the elderly population. So that is what we have.
Is that something that the Ministry of Health is working towards? Because we know that when it comes to gastrointestinal diseases, that the rotavirus is in fact one of the main causes.
So far, there have been discussions, but there hasn't been a decision to introduce. Because one of the things too that we need to consider is the burden of disease against the introduction of a new vaccine in the country, and then of course the price of the vaccines out there are still for rotavirus is still high.
Okay.
But it's in the discussions.
Yeah. Now tell me about what the conversation is like with parents when they bring their babies in for vaccinations. Is it an automatic practice that parents are simply bringing in their children because they know it should be done?
No, actually, to some extent it is, but to some extent it's not, because we start talking to them from during the pregnancy. So while they are still pregnant, we'll start letting them know what vaccines will be offered and the schedule for the vaccinations, so that by the time they have the baby, they already have a basic idea. When they reach the hospital setting again, they tell them about it, so let them know. In some cases, the first vaccine is offered right in the hospitals as well for the babies, so that by the time they come out, they already started their immunizations.
And the importance of getting vaccinated, getting protection at that early stage, because when you're under 5, you're most vulnerable for any disease that would come, and then the protection that the child receives from the mother would only last for about 3 months, and after that it wanes, and then the child is unprotected. So we need to protect them. So we need to tell them about the importance of vaccination, and once they understand how important it is to have protection, because diseases are still out there. While we in Belize have eliminated measles and rubella, actually the country was declared having eliminated rubella and congenital rubella syndrome in 2015, and in 2016 as having eliminated measles. So. And now we are working towards the eradication of polio.
Yes. And at this point, there are only 3 countries in the world that still have polio. So we're very close globally.
Yes.
Now, looking at the follow-up vaccinations, I know that is one of the hallmark programs of the Ministry of Health, where you try to ensure that not only the preliminary vaccines are administered, but that the boosters, which are at a later age, are also done. That requires quite a bit of mobilization. Tell us about that.
Okay, while we have been improving over the last 5 years in terms of the booster doses or the second doses of, actually for the second dose of MMR, we are not, we are at 95%.
Okay.
So, and in terms of the booster doses of polio and diphtheria, tetanus, we have improved to 85%. So that has been a good improvement since.
Yeah. Let's, Eufemia, let's talk a bit about this particular region of the world. This region has been heralded as doing very well when it comes to immunization schedules and prevention of the spread of quite a number of diseases that are covered by vaccination. Why is that important when you put it in the context of the rest of the world?
What happened, Marlene, when we look at it, Belize is small, but we have challenges, and we try actually to conquer those, and so we have managed to have this high immunization coverage in terms of other areas that other countries that do not have the same, and so our little Belize, we have to protect it, and we have to protect it from the other areas that have, for example, in some countries they have stopped vaccinating, and so they have had outbreak of diseases, and we have to protect our population against the importation of any disease.
Yeah. Are vaccinations mandated in Belize?
Mandated as such, no, but we do have a immunization immunization policy that comes under the Public Health Act, where you are mandated to be vaccinated. But the thing is that we do not enforce it because there's no need for that. We have high coverage over 95%. So if we protect 95% of the population, the other 5% that is not protected actually have some protection because of that, like what we call herd immunity.
Yeah.
And so that's.
Yeah. And there are some specific areas of the country where there is less coverage. For what reasons?
Well, that is, we believe then in part it is because of the high migrant population and it's the south and the like Stan Creek, it would be Stan Creek and Kaya district, and it's because of the migrant population that is there.
Yeah.
And the other thing is that when we calculate coverage, we only take into consideration the third dose, the complete doses then. Yeah. So if it's polio, it's 3 doses by the time you're, before you're 1, or before you're 12 months. And so any doses given after 12 months of age, that is not counted in the coverage. But those are later doses, which would, the child would still have protection, but all that time when the child was not vaccinated up to 1, then that poses a risk for the child who not completed vaccination within the schedule.
Yeah. Now, talk about the theme for this year. Get vaxxed for a healthy tomorrow. What is the specific message that you hope people will be able to receive when they hear the theme being commemorated?
That if you are vaccinated and you protect yourself now, you can enjoy better health tomorrow, because vaccines have, it is proven that vaccines work and that it saves lives. So once, and then again, when you talk about not being protected and you contract one of the diseases, for instance, measles, the complications is the problem there, that you would be probably, if just a high fever of measles could cause brain damage, and that is irreversible, and so the child would not learn in school. So we want health children to enjoy a good tomorrow. So protecting yourself now guarantees that that a healthier population.
Yeah. Kevin, do you ever find yourself in the position where you have to convince parents to vaccinate their children?
Not really. The biggest concern usually for parents is my child will get an injection, and they're usually worried about that injection. My child will cry. But when we just explain to them the benefits of the vaccination versus catching one of these diseases that will make them sick or crippled or have learning disabilities, usually most parents are up for it. Who wants a sick child? Most of them want a healthy child, so they usually grab at it.
Now let's talk about some of the controversy when it comes to vaccinations. We know that in other parts of the world, there are many people who they call anti-vaxxers, who choose not to vaccinate their children and encourage others not to do the same. And there are many reasons that they say, including some of the points that you just pointed out. What is the level of objections that you find? Are you finding more and more people in Belize saying, oh, I don't want to vaccinate my children because of X, Y, and Z? Are you finding that scenario?
Yes, that is the challenge that we are faced every day. That more and more people are coming out and saying they don't want the vaccine, but it's mainly like this: I don't want the vaccine. I heard so and so, and I heard so and so. But once you explain to them, and once we tell them about the vaccine and the benefits, as Mr. Dawson said, then it's not hard for them to make the decision.
Yeah.
So.
And what do you tell them to be able to educate them on the information that they have heard?
Basically giving them the facts and said, you know, every day your child is exposed to many bacteria, many viruses, and if one day the child would come in contact with the disease, then the child, if not protected, would become ill. But one of the things that we usually say is the reasons why we don't see those diseases now is because vaccination coverage has gone up. Yeah. And so if it is true that the vaccines wouldn't work, then we would still be seeing many of the diseases that we are already not seeing, that are not common now. For instance, in Belize, we have not had polio since 1981, and then measles since 1991. So those are some of the things that we need to look at. Before that, we had 140 hundreds of cases of measles, and then and complicated cases as well. But since coverage went up, then and so there is proof that the vaccines do work.
Are there any risks associated with the vaccinations that we offer?
Well, risks in that context, no, because we do have the side effects of vaccines.
Yeah.
And then when you compare the side effects of vaccines, which would be generally fever and pain on the arm at the injection site and redness, the risk, it is more likely that somebody would develop more injury when contracting the disease than from the vaccine itself. So.
Now, let's talk about how this celebration or the commemoration of Vaccination Week will be rolled out in Belize. Is this an education or awareness period that you embark on?
Yes.
I think it is education, but it's also us going out to the community and not just educating them, but actually giving those who maybe couldn't come to the clinic as well. So it's a little bit of both. It's education and it's actually getting to them and giving them the vaccines.
It's reaching out to that population that doesn't come to the facility. So making immunization accessible to everybody. To the entire population.
So it is a good time for people to catch up if they haven't been able to do their follow-ups as yet.
Yeah.
Well, let's take the opportunity to go through the schedule, as is the preferred method coming out of the immunization schedule. So where do we start? Go ahead and tell me, Kevin.
Okay, so we start out first of all with the BCGs, all right? That's the one that protects against tuberculosis. And then after that, we go to the, that one is at birth or a little bit thereafter. Then we do the IPV, which is the pentavalent vaccine, along with the sorry, with that's the we give that along with the penta. All right, which is the polio. The IPV is the polio along with the penta for 2 months. Then we repeat it again at 4 months, but we give it by polio drops instead. And then again at 6 months. Right, at 6 months we also give the seasonal influenza vaccine, and then at 7 months we bring them back for the final half of the influenza vaccine for that season.
Okay.
Then at 1 year we give them the MMR, which is for the measles, mumps, and rubella. And then at 1.5 we give them the second half of that MMR vaccine, along with the polio drops as well, a booster dose of that one. Then finally at 4 years we give them the DPT, which is diphtheria, pertussis, and tetanus, along with a polio drops as well for booster. All right.
And then you have your seasonal flu shots that continue, right?
Yeah.
Okay, and that's every year,
That's every year, yes.
administered for free by the Ministry of Health.
Free. All vaccines are provided to the public, are offered to the public free of charge.
Yeah. And then the HPV, which is new in its rollout, takes
Yes.
place at what point?
Since we do it in school, it's a school base, so we do it in May and November. So that's why we introduce in November. Now, coming in May, next month, or we are already there. The second dose will be provided in schools for those who have had their first dose. And for the persons who actually did not wanted the first dose for reasons that probably they were afraid, or they wanted to see how it works with the rest of the students, then they have an opportunity to get their first dose when they issue the second dose to the ones that got the first dose. And then we have the pregnant women, and where we provide them with the TD vaccine, which is the tetanus and weakened diphtheria to protect the unborn child at birth. And we also offer them the flu shot for the pregnant women, because once if a woman is pregnant, contracts H1N1, it will affect her worse than it would affect you and I who would not.
And then the elderly population is also encouraged to get.
Yes, the elderly, we encourage them. In fact, I think one of the in the Keon district, they will be visiting the home for the elderly to provide them with the flu vaccine. And it's our recommendation that we have, that is one of the groups that we target for vaccination against the flu, the seasonal flu.
Yeah. And you receive that vaccine before the start of the flu season?
Actually, like our flu season, well, now we have two. We find out that we have 2 peaks now, but actually, it would start in September. October to March would be, but we have seen a peak also around May, June, yes. And so, but the vaccine, it's a vaccine that is made every year, and it changes. So we get it in the first week of October, and that is when we start vaccination. As soon as we get the vaccine, we already have the persons asking for the flu, and it has worked, because in Orange Rock, for instance, the nurses are saying many of the people who, like diabetic persons who suffer diabetes, many of those persons, they come for the vaccine because it has helped, and they have not had flu for a very long time.
Now, in the advent of technology and the reach that people now have in terms of spreading different messages, it is perhaps only inevitable that we start to see more and more messages from persons who are against vaccinations. What is the mechanism in place for the Ministry of Health in terms of being able to not take for granted that parents understand how and why vaccines work, but that the message is continuous to ensure that they do what is right for their children?
Well, one of the things we do, as you know, we don't advertise much on national media, which is something that we are trying to move towards. But again, we have sessions, meetings with parents, and so from time to time the nurses go to the PTA meetings and have sessions with parents. Bringing the facts, the messages that vaccines work, and we also ask the population to not carry themselves by what people or groups are saying,
Yeah.
but go in, get the information, get the right information. We are also in the process of developing the brochures that will provide you with information. Also, we ask them to read the sites that are trustworthy, which would be the WHO, the World Health Organization websites, and the CDC websites. And those are the two that we recommend for people to go in, get the facts, because there they do not only have the vaccine is good and these are the mild side effects and whatnot. They present everything from the what would be a severe side effect to a mild side effect, and then the many trials and the many tests that have been done.
Yeah.
Because the vaccines we provide are pre-qualified by PAHO, and they go through constant and rigorous testing before they are even put out in the market. And once they're in the market, they also continue testing, and any report that we make based on a side effect or something that happened because probably related to the vaccine, it goes through continuous studying. So,
so people can feel safe.
Safe vaccines.
That there have been enough tests before.
Exactly. Yes.
Precisely. So, in closing, what would you like people to know about why it is important to get vaccinated?
Okay, we have the vaccine. We encourage persons to do their part in protecting themselves. While we haven't had any of those infectious disease in the past, but there are countries out there that still have it. So it is important that you get protected, get your child protected, get yourself protected. Not because you feel okay means that you can't go out there and bring back the disease, or someone would come into our country with the high tourists.
With the tourism.
Yes,
Right.
so it is important for you to get protected and get your family protected against those diseases. Because the moment we stop vaccinating, then that is the time when you expose yourself to many other diseases.
I also remember that while it's not, we have to look out for people coming into the country from other countries that may have these diseases still. Sometimes you yourself might want to travel out of the country. Your kids later on might want to travel and go to other places to visit, sometimes maybe just to study in other places, in the universities and things like that. So protect yourself from now, all right? And that way later on, when you do go out, you know you are still safe.
Okay.
Remember, viruses have no borders.
That's right. Well, thank you both for coming in this morning and having this conversation. Of course, this week is the World Immunization Week, and once again, that theme is Get Vax to celebrate a healthy tomorrow. Thank you both.
Thank you too.
We're going to go ahead and take a break, and when we come back, we'll be joined by representatives of UNIBAM talking about their ongoing conference on sexual orientation, gender identity, and the law. So stay tuned.